Hi, my name is Tori and I'm a GCH Global Community Health BS student at UC Santa Cruz. Well, I chose GCH because I think the program does a really good job of connecting the different interdisciplinaries of like social sciences, biological sciences, and also like psychology. It's just like a really great multifaceted program because where else would I be able to learn about the Global Community Taskforce while I'm taking my biochemistry and my other sociology classes? So my task force is focusing on GLP-1 receptor agonists, also known as Ozempic, Wegovy, semaglutides. It's basically medications like Ozempic and Wegovy that are used to treat type 2 diabetes, but they can also treat obesity in some patients. So we kind of look not only at the medical aspects of the medication, but also at the societal and the political or the policy implications of the medication. And that's all due to their growing popularity. Like the Ozempic boom has only shot up in the last 2-3 years. I feel like this class is a very realistic take on like what a lot of us GCH majors will be facing out in the real world, like science, society, and policy. Like we all are going to see that sometime in our careers, and it just pushes us to like analyze a threat, or not threat, but a health issue from like multiple angles. So I'm going to assume Santa Cruz is like every other American city where we have a large amount of people with heart disease and like other chronic diseases that affect their lifestyle. And access to Ozempic would be like greatly beneficial for people with diabetes or like obesity related issues, and GLP-1 medications can be life-changing for these people, but it's really hard to access due to like barriers in care. And like just because of this, the conversation around Ozempic isn't just medical, it's just like about affordability, misinformation, and community health literacy. Okay, so my class is compiling all of our findings into a large task force report. So imagine 20 people all writing 30 pages about Ozempic, the medical issues, the medical science behind Ozempic, the basic science behind Ozempic, the societal impact of Ozempic, and the policy changes that should be implemented to control Ozempic, and like the just like control Ozempic. And we're just developing like a very accessible report that anyone can read if they want to like be informed about like any of those topics. And I'm just learning how like interconnected medicine is with like social media culture, and also like how public health isn't about like just the treatments, but also about like how society interprets these treatments. Because Ozempic wouldn't be this popular if people didn't know it was like a weight loss hack. If it was only just a type 2 diabetes medicine, it would be like less known about. Like other medications, like you don't see anybody taking insulin to lose weight. Best task force professor on campus. He like went through the syllabus with us, and I knew this was going to be not only a really like informative class because we had guest speakers coming in, but this guy actually cares about helping us write this like report, and I get a published report with my name on it. So that's like, that was just like my favorite memory ever, because I knew this was going to be one of my favorite classes to take senior year. And it is.